Hello everybody, my name is Dr. Ajit. My presentation for today is diabetes and macrovascular diseases. But I'm here to tell you more about how to live well with diabetes and to prevent complications. So let's begin. Well, I'm sure most of you know about diabetes. But how many of you would know about hyperglycemia? Well, hyperglycemia means high blood sugar. Hyper means high and glycemia means blood sugar. So both of them are risk factors for heart disease and lead to more chances of heart attack, stroke, blood flow problems in legs leading to ulcers and even amputation. So now we all know that diabetes and hyperglycemia are risk factors for heart disease, stroke, and lower limb disease. But having said that, people with diabetes are also more likely to have certain other conditions or risk factors like high blood pressure, high cholesterol, obesity, and abnormal kidney functions. They can also have a family history of heart disease as well. And they all can lead to heart disease, stroke, lower limb disease, leading to blood flow problems in legs, leading to even ulcers and even amputation. So don't you think it's a double impact? Diabetes and hyperglycemia being risk factors for heart disease, stroke, and lower limb disease, and people with diabetes can also have risk factors leading to similar problems. We all know that good blood sugar control is very, very important to prevent complications. But what do you really mean by good sugar control and how do we achieve it? Well, normal blood sugar levels are as follows. Fasting could be between 3.8 to 5.6 millimoles per liter or 70 to 100 milligrams per deciliter, and 2 hours after food, that is postprandial, could be less than 7.8 millimoles per liter or 140 milligrams per deciliter. Well, these are values provided by the WHO and the American Diabetes Association. So, in my previous slides, I spoke to you about normal blood glucose levels. They are the target levels. But having said that, target levels should be individualized. They are based on duration of diabetes, age, life expectancy, other associated conditions, and individual patient considerations. So, what do you think about it? Well, it only means that your doctor is the best decision maker. Since our topic for today is diabetes and macrovascular complications, so let's talk more about it. Diabetic complications are divided into microvascular, meaning damage to small blood vessels, and macrovascular, meaning damage to large blood vessels. Micro means small, vascular means blood vessels, macro means large, and vascular again means blood vessels. So this figure here will definitely tell us what micro and macrovascular complications mean. Micro affects the eye, the kidney, and the nerves. Macro affects the brain, the heart, and upper and lower limb blood vessels. Let's come to our actual topic today, macrovascular complications. Like I said before, macro meaning disease affecting large blood vessels. These include cardiovascular diseases such as heart attacks, strokes, and insufficiency in blood flow to the legs. What are the signs and symptoms associated with macrovascular complications? Meaning, how do they present? When affecting heart, can present with a chest pain or abnormal heart rhythms. When affecting brain, can present with confusion, facial droop, paralysis, dizziness, slurred speech, gait difficulties, and visual loss, when affecting extremities, can present with leg pain, initially during physical activity, later on pain at rest, and can even lead to ulcers. Many cases present without symptoms. How to screen for macrovascular complications in diabetes? In other words, how to detect them? Well, it is by taking a detailed medical history by the doctor, a general physical examination, again by the doctor, hypertension, which is detected by measuring blood pressure every visit, dyslipidemia, or abnormal blood cholesterol levels, is detected by measuring fasting lipid profiles, which is done at least annually. Well, you might ask me, how do I lower my chances of a heart attack or stroke if I have diabetes? Well, it is possible, and it is by taking care of diabetes, having a well controlled diabetes, by managing the ABCs in diabetes. A stands for A1C test, B stands for blood pressure, C stands for cholesterol, S stands for stopping smoking. Well, you could stop smoking by getting help to quit smoking, by attending smoking cessation clinics, etc. And of course, by controlling weight. So, by now you have understood the ABCs of controlling diabetes. What is a A1C test? What does it really mean? A1C test is a blood test conducted to understand the last 3 months average blood sugar in a patient. But this can vary depending on individual patient profiles. The A1C goal for many people with diabetes is below 7%. Some people may do better with a slightly higher A1C goal. Well, your healthcare provider is, of course, the best person to answer your queries regarding your A1C goals. So ask your healthcare team what your goals should be. B stands for blood pressure. High blood pressure is proven to cause heart attack or stroke and damage your kidneys and eyes. The blood pressure goal for most people with diabetes is below 140 by 90 millimeters of mercury. C stands for cholesterol. There are two kinds of cholesterol, the good and the bad. LDL, or the bad cholesterol, can build up and clog your blood vessels. Too much bad cholesterol can cause a heart attack or stroke. HDL, or good cholesterol, helps remove the bad ones from your blood vessels. Ask your healthcare team what your cholesterol number should be. If you are over 40 years of age, you may need to take medications to lower your cholesterol and protect your heart. S stands for stop smoking. So it gives a double impact, as we all know. It is a risk factor. So smoking narrows blood vessels, and diabetes does the same, leading to increased incidence of heart attacks and stroke. Just look at this picture. Well, it is not a laughing matter. This poor fellow died shoveling snow. Well, what do you infer from the picture? Well, there are two or three factors involved. One is smoking. So smoking narrows blood vessels, and the extreme cold again narrows the blood vessels. And if he had diabetes, a third risk factor, so what can it lead to? A heart attack. So that's what happened to him. Haha. And this is why I say my patients to stop smoking and not to stay away from smoking. So the good news is that the steps you take to manage your diabetes also helps to lower your chances of having heart disease or stroke. Many patients ask me, since diabetes is a difficult condition and it can lead to serious complications, so how well do they live with diabetes? Well, I tell them my own acronym for this: diabetes mellitus, or in short DM, could correlate to the acronym DEM. So DM for DEM, and DEM stands for diet, exercise, and medication. Or it could also be DEMSA, DEMSA, which again stands for diet, exercise, medication, quit smoking, and reduction of alcohol. So let's now talk about diet. Remember, there may be many diet regimes in the market. There's no one size fits all diabetes diet per se. So healthy eating for everyone with or without diabetes does not really need any hardcore diet plans. The basic concept is to include more fiber-rich fruits and vegetables, to take whole grain carbohydrates in moderation, powering up with lean protein, to eat moderate amount of healthy fats, limit carbs to 60 grams and space it out in small portions throughout the day. There are many myths associated with diabetes. Some of them are: number one, favorite foods have to be sacrificed forever. Not true at all. Excess sugar is bad. Yes, eat no more than 10% of your total calories from added sugars, sweets, sugary cupcake, or white bread. Second is, you shouldn't eat fruit. If fruits, especially berries, apples, and melons, are removed from the diet, then important vitamins, minerals, antioxidants, and fibers are lost. So we do have to eat fruit, but of course, eat in moderation. As a clinician, I don't recommend the exotic diet regimes available in the market. Some of the popular diet regimes are the Mediterranean diet, DASH, or the Dietary Approaches to Stop Hypertension diet, ketogenic diet, intermittent fasting diet, and the paleo diet. ADA recommends filling half of the plate with non-starchy vegetables, one quarter with grains or starchy food, and one quarter with lean protein like the beans, seafood, skinless chicken. Here is an example of the diabetes portion plate that I mentioned earlier. Well, half of the plate should contain non-starchy vegetables, one fourth with starchy food, another fourth with lean proteins, a portion of fats and oils, an 8-ounce glass of non-fat or low-fat milk or yogurt, add a few pieces of fruits or a half cup of fruit salad. Now let's talk about exercise. The ADA, or the American Diabetes Association, recommends 150 minutes of moderate intensity or 90 minutes of vigorous aerobic exercise per week. Patients with loss of sensation in their feet should limit weight-bearing exercise. Well, from my experience, I have observed that strength training exercise or resistance exercise can do a lot of good to patients with diabetes, because patients with diabetes have a lower muscle mass, and increasing the muscle mass can of course tilt the balance in favor of increased muscle mass and a lower fat mass. Another point is, because of the CVD risk in patients with diabetes, appropriate screening for CVD should be performed before patients engage in an exercise program. Yes, don't shy away from exercise. It can't really kill you. Exercise more often and remove the conveniences behind. So let's come to the M in the acronym, the medications. You might be prescribed medications to reduce macrovascular risk like high cholesterol, high BP, and obesity as well. The ADA recommends BP targets of 140 by 90 millimeters of mercury. One or more drug may be required to reach BP targets. Good sugar control may be achieved with one or more oral medication or insulin. May require medicine to protect your heart like aspirin or clopidogrel. Statins are a type of medicine often used to control cholesterol. And about medications, let your doctor decide on the medication with your support, but do not stop them without his support. So now, let's summarize. Diabetes and prediabetes lead to macrovascular complications due to high blood glucose and so-called insulin resistance. Good but not intensive glycemic control is important. But more important is a global approach consisting of lifestyle modifications, decreasing hyperglycemia, and treating cardiovascular risk factors associated with diabetes is very important. And there is evidence from many clinical trials that good blood glucose control in both type 1 and type 2 diabetes can delay the onset and progression of these complications. But the target of blood glucose control should be tailored to the individual patients. Diabetes increases the cardiovascular risk by 2 to 5 fold. So, good blood glucose control leads to reduced risk for both microvascular and macrovascular complications of diabetes. Screening and treatment of risk factors, especially dyslipidemia, high blood pressure, is associated with a reduced risk for heart disease. Blood pressure goals for patients with diabetes should be less than 140 by 90 millimeters of mercury. Well, friends, here I come to the end of this presentation on macrovascular diseases and diabetes. And I hope you all shall now live well with diabetes. Wishing you all good health and bye for now.